You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Kaylee Delschmidt, BHC Manager of Wellbeing Strategy and Member Services.
Hello, I'm Kaylee Delschmidt, and welcome back to the BHC's Be Health Connected podcast. In today's episode, we explore the National Diabetes Prevention Program, National DPP for short, and why employers should consider it as a solution to address the rising number of employees at risk for developing type 2 diabetes in their population. Diabetes is a growing concern globally, with millions affected by its impact on health and quality of life. Employers play a pivotal role in promoting employees' wellness and mitigating the risks associated with chronic conditions like diabetes. The National DPP Lifestyle Change Program offers a structured, evidence-based approach to preventing type 2 diabetes through lifestyle changes. Today, I am joined by Sara Hanlon, worksite health consultant with the National Association of Chronic Disease Directors, or NACDD, to speak with us about the National DPP Lifestyle Change Program and opportunities for employers to learn more about how they can offer this program as a covered benefit for their employees. So, Sara, thank you so much for joining us today.
Absolutely. Thanks for inviting me, Kaylee.
So I think to get started, I'd just like to ask if you could tell us a bit more about how the public health organization like NACDD got involved with benefit design and worksite health.
Yeah, absolutely. As a consultant with NACDD, I've spent a lot of time helping bring public health programs, policies, and tools to benefits professionals across the country. So I'm excited to share a bit more with your members and listeners today. In partnership with the Centers for Disease Control and Prevention, or CDC, we're working to speed up adoption of highly effective, lower-cost, evidence-based solutions by employers of all sizes and industries. Public health organizations like CDC, NACDD, and state and local health departments are often an untapped asset for benefit teams. So I'm excited to share today about how we can assist specifically around diabetes prevention and management. Over the past several years, I've been fortunate to lead a national initiative to support state departments of health alongside business coalitions like yours in providing strategic support to integrate CDC-recognized lifestyle change programs into benefits packages for those at highest risk for type 2 diabetes. We've now supported 26 states and over 300 employers so far, and we actually just added another 6 states this month.
It sounds like the program has some great reach, and there's been a lot of time on the ground with this. So I'll ask a little bit more about what you've heard from employers during that process shortly, but I'm hoping you can tell us a little bit about diabetes prevalence and the cost among the working population first.
Yeah, of course. Let me start just by offering a few statistics, then I'll show what that might look like for a typical work site. So over 37 million Americans are living with type 2 diabetes, which is about 1 in 10. Each year, we collectively spend over $250 million treating type 2 diabetes. And on average, people with type 2 can expect to incur over $9,500 per year just in related healthcare costs. We know costs continue to rise year over year, so getting control of that growing population is really critical for our benefits budgets. I'd also like to make the distinction between type 2 diabetes and those with prediabetes. So this might be a little less familiar for some. Prediabetes is a condition where the blood glucose is elevated, but it's not yet high enough to be diagnosed with type 2 diabetes. And this is really where we have our biggest opportunity for impact. 93 million Americans, or 1 in 3, have prediabetes. That's a lot of numbers, so let me offer an example with some broad estimates you might want to consider. I'd encourage your listeners, maybe grab some paper, do this part with me. So let's say I'm considering an organization with 10,000 employees. Of these, 1 in 10 is likely to have type 2 diabetes already. So that puts us at about 1,000 employees with an additional 9,500 in diabetes-related medical costs annually. So that's over 9.5 million per year for this employer to treat a condition that's preventable. Now let's look at those remaining 9,000. Out of those, 1 in 3 are likely to have prediabetes. So that's over 3,000 employees who are at risk of transitioning to type 2 diabetes if they don't take action. It's so imperative that we shift our focus from only treating the condition to starting to incorporate prevention and lifestyle management throughout the continuum of diabetes. Not only will that benefit the bottom line for an organization, but will also support the employees in living healthier and happier lives.
I think those statistics are so important to share and recap as we just grapple with not only the financial burden, but just the prevalence and the burden of this chronic condition amongst the population. So there's a lot of discussion right now about diabetes and weight management medications. I know a lot about this, especially having supported our pharmacy program for a little while, and just the amount of spend associated with them. And so a lot of employers are talking about the diabetic class of medications. So will this address the need for diabetes prevention?
Yeah, I'm really glad you brought this up. Like you said, it's such a priority topic for benefits teams right now. So GLP-1s, that class of medications that we're starting to hear more about, approved by the FDA for type 2 diabetes and most recently approved for chronic weight management. They've really changed the focus to the prevention part of the diabetes continuum. So we're thankful for that. That's really great. There's a lot that we're still learning about these newer medications, and we feel like it's going to require longer term studies to really understand the benefits, the risks, and the side effects. Specifically, it's not yet known what impact these drugs may have on the risk for developing type 2 diabetes or those diabetes-related complications. That said, I'd like to share 4 key things that we do know. First, there's strong and consistent evidence that even modest weight reduction can delay that progression from prediabetes to type 2 diabetes. Second, we know that many employers have added coverage of the GLP-1 class of medications for weight management, and that we're trying to figure out how to balance that higher price tag with the potential reward for increased employee satisfaction, health, and well-being. The third thing we know, the FDA recommends that GLP-1s for chronic weight management should be used alongside lifestyle change, such as healthy eating and increased physical activity. Lifestyle change continues to be the key for preventing or delaying type 2 diabetes. And finally, the fourth thing that we know, the National Diabetes Prevention Program, Lifestyle Change Program, provides a full year of support for building those healthy habits like eating healthy, being active, and reducing stress. So kind of to summarize all of that, while medication therapies are demonstrating great effectiveness in diabetes prevention and weight management, long-term and sustainable changes must also include opportunities for lifestyle change for your employees.
So you mentioned the National Diabetes Prevention Program, Lifestyle Change Program. Can you tell us a little bit more about what that is and how it fits within a typical benefit structure?
Yeah, of course. The National DPP was first established in 2010, and it's built on evidence that shows lifestyle interventions can cut the risk of moving from prediabetes to diabetes in half. The Lifestyle Change Program is a CDC-approved year-long curriculum where participants learn things like how to track their eating habits, their physical activity levels, setting goals and staying motivated, and overcoming barriers and triggers. A lifestyle coach and a peer support group are there to support them along the way through a regular cadence of sessions. And the program can be offered in person, virtually, or in hybrid delivery. The real key here is the evidence base and knowing that a CDC recognized organization will deliver the program and really keep true to the fidelity of the model that we know delivers those results. And as far as what that looks like in a benefit structure with an employer, I mentioned earlier that we've been working on this for several years, so I feel like we have a pretty good understanding of this now. For many organizations, it's as easy as finding out if it's already part of the benefit package through their health plan, PBM, other wellness vendors. It's still important to make sure that that existing offering meets the workforce needs, but it's a quick win if it's already available and does meet the needs of the organization. So many other employers have also developed contracts directly with the CDC recognized organizations. And depending on the industry, some have also found great value in actually becoming recognized and delivering the program in-house. Our role and the role of state departments of health all across the country is to make this process as easy as possible so we can get employees engaged and enrolled in a program that we know makes a difference.
Sara, do you have examples from employers that have successfully offered the National DPP lifestyle change program to their employees? And the second part of that question would be, what have you observed regarding the return on investment from those employer examples?
Yeah, absolutely. We do have those examples. I want to start with the money part of this question, though, as I haven't really addressed that yet. So it does vary by benefit structure, delivery organization, and things like incentives. But the average cost of an employer-sponsored National DPP lifestyle change program is under $1,000 per employee per year that participates in the program. We've seen a variety of payment models ranging from flat rates, attendance-based, and outcomes-based payment models. But regardless, the cost is very reasonable next to the value it brings in preventing that larger spend we talked about for diabetes management. Now, I do want to acknowledge the return on investment for prevention activities just takes a bit longer than it does for some other interventions. What do I mean by that? So think about an employee that might be participating in this year-long lifestyle change program. Part of the reason it's a year long is to make sure that habits stick. So first we have to get the employee to do things like increase healthy food consumption and their physical activity minutes. Then over time, we'll see those physical changes like reduced weight, maybe even blood pressure. But to truly see that return, that's going to come for the employer when they see that diabetes trends start to come down over time from things like less medical supplies, less pharmacy costs, less complications and hospitalizations. But even though it takes time to show up in the data, we're seeing a lot of great examples from employers that are already feeling the impact. So I'll share just a couple today. The first one I want to start with, the city of Wilmington, Delaware. They have over 1,000 employees. Through their work with their Department of Health and their local business coalition, the city started their diabetes prevention program in 2019. In their first offering, they had over 10% of their employees show up to learn more and over 60 enrolled in the program. The city estimated in that first offering alone a cost savings of over $150,000. They've continued to add to the program over time and seen tremendous engagement and change in health status. For the city, it was very easy to get started. They were able to reach out to their third-party administrator to find out that it was already available. I'll also just mention Miami-Dade County Public Schools School District as another example. As you know, so many challenges for this industry to keep up with many distractions on top of trying to keep employees healthy. But they've absolutely taken off with diabetes prevention. During the first years of their national DPP benefit, the district enrolled over 2,600 individuals who lost over 15,000 pounds. They've reported their participant satisfaction is very high, and they're continuing today to grow their program.
It sounds like they've achieved a great level of success and engagement among their plan members. So that's a great example. Thank you for sharing that. I'd love to know more about the support that you're providing to employers and local partners. And then also how this can help our listeners today and where they can learn more about diabetes prevention as we look to kind of wrap up our conversation today.
Yeah, absolutely. As you can tell, I could talk about this all day long, but there are a lot of resources that we can follow up with to help employers get connected and learn more. Just a few actions I'd suggest. I mentioned that we've now engaged 32 state departments of health to provide that employer support. I really want to advocate for this for a moment. These public health professionals are trained in a number of skills that can be valuable to your benefits team, just an extension of what you're already doing. Things like health promotion, strategic planning, evaluation, and of course, diabetes prevention and management. Your public health partners are going to know the local partners. They have access to the latest information, trends, and data at both the state and local levels. If you don't know your contact, NACDD team is, of course, happy to help make any connections. Also, taken all that we've been kind of learning in these past few years from engaging with employers across the country and use that to create an online decision support tool that we refer to as Helm. Helm is a free-to-use tool, and it not only gives more information about the National DPP Lifestyle Change Program and specific recommendations based on the organization that's using it, but it's also another way that we can connect you directly with your state's diabetes professional. So I would encourage everyone to just take a moment and go ahead and create an account at helmatwork.org. And finally, NACDD and CDC collaborate to host regular continuing education offerings for benefits professionals. Your listeners can stay up to date on our upcoming events by joining that Helm Employer Network. It's just a great chance to hear directly from other employers who have really found success with their program.
Well, thanks so much for all of your insights and all the information you shared with us today, Sarah. It sounds like the NACDD and the CDC are doing some great work to help employers address the burden of chronic conditions such as diabetes and prediabetes. So we're very excited to learn more and to share this information. And thank you again so much for joining us.
Thank you for your ongoing leadership.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.